Which element is reduced at the cathode of a Clark polarographic electrode? A. Silver. B. Oxygen. C. Potassium. D. Chloride. The answer is A. Silver.
All of the following influence glomerular filtration except A. Renal or urinary calculi and decreased renal blood flow. B. Hyperglycemia and renal tubule malfunction. C. Cardiac failure and renal or urinary calculi. D. Decreased renal blood flow and cardiac failure. The correct answer is A. Renal or urinary calculi and decreased renal blood flow. Albumin, alpha-1, alpha-2, beta, and gamma globulin are electrophoretic fractions of A. Serum lipoprotein. B. Hemoglobin. C. Amino acid. D. Serum protein. The correct answer is D. Serum protein. An elevated leukocyte count with increased numbers of neutrophilic granulocytes usually indicates A. Bacterial infection. B. Viral infection. C. Allergic reaction. D. Infectious mononucleosis. The correct answer is A. Bacterial infection. A mother is Rh-D negative. The father is homozygous Rh-D positive. All of their offspring will be A. Homozygous Rh-D positive. B. 50% Rh-D positive and 50% Rh-D negative. C. Heterozygous Rh-D positive. D. Erythroblastotic. The correct answer is C. Heterozygous Rh-D positive.
The major groups of worm parasites includes all but one of these. A. Flukes. B. Tapeworms. C. Roundworms. D. Ringworms. The answer is D. Ringworms.
Leukemia may be suspected when a manual hematocrit determination reveals A. Hemolysis. B. A high hematocrit. C. Icteric plasma. D. A heavy buffy coat. The correct answer is D. A heavy buffy coat. Enterobius vermicularis is A. Filarial worm. B. Flatworm. C. Pinworm. D. Hookworm. The correct answer is C. Pinworm. The infective stage of the hookworm is the A. Filariform larva with a pointed tail. B. Rhabditiform larva with a long buccal cavity. C. Rhabditiform larva with a short buccal cavity. D. Filariform larva with a notched tail. The answer is A. Filariform larva with a pointed tail. In using a urinometer to measure specific gravity, the correction factor for each 3 degrees Celsius higher or lower than calibration temperature is A plus minus 0.001, B plus minus 0.100, C plus minus 0.010, D plus minus 1.001. The answer is A plus minus 0.001.
A patient's blood gas results are as follows: pH equals 7.26, DCO2 equals 2.0 mmol, L, HCO3 equals 29 mmol, L. These results would be classified as A. Respiratory alkalosis. B. Metabolic alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. The answer is C. Metabolic acidosis.
A flotation method for concentration of ova and cysts used. A. Zinc chloride. B. Concentrated formalin. C. Ammonium sulfate. D. Zinc sulfate. The answer is D. Zinc sulfate. Blood glucose levels are directly regulated by the hormone A. Hydrocortisone. B. ACTH. C. Thyroxine. D. Insulin. The answer is D. Insulin. A flagellate frequently found in the urine of female patients is A. Entamoeba coli. B. Trichomonas vaginalis. C. Trichomonas tenax. D. Trichomonas hominis. The answer is B. Trichomonas vaginalis.
Which of the following phyla contain important parasites of man? A. Protozoa. B. Annelida. C. Platyhelminths. D. Nematoda. The answer is A, C, and D, Protozoa, Platyhelminths, and Nematoda.
In Taenia saginata, the larval stage develops in A. Swine. B. Cattle. C. Fish. D. Man. The answer is B. Cattle. If test results are within plus or minus 2 standard deviations, the ratio of test results beyond the plus or minus 2 SD limit will be 1 out of A. 300, B. 20, C. 3, D. 5. The answer is B. 20. Dilute normal urine is usually A. Dark yellow. B. Pale yellow. C. Reddish yellow. D. Amber. The answer is B. Pale yellow. Sodium is responsible for the maintenance of A. Salt intake. B. Osmotic pressure of body fluids. C. Blood coagulation. D. Cardiac muscle contractions. The answer is B. Osmotic pressure of body fluids.
Safranin in a gram stain is used as A. Mordant. B. Primary stain. C. Decolorizer. D. Secondary stain. The answer is D. Secondary stain. Which of the following conditions is associated with hypokalemia? A. Digoxin intoxication. B. Hemolytic anemia. C. Alkalosis. D. Addison's disease. The answer is D. Addison's disease. The ketone bodies include acetoacetic acid, acetone, and A. Acetic acid. B. Lactic acid. C. 3-hydroxybutyric acid. D. Oxaloacetic acid. The answer is C. 3-hydroxybutyric acid. Fibrinogen determinations are performed on A. Either serum or plasma. B. Plasma only. C. Any body fluid. D. Serum only. The answer is B. Plasma only. In serologic tests for syphilis, Reagan reactivity may result from an acute or chronic infection such as A. Lupus erythematosus. B. Pneumonia. C. Infectious hepatitis. D. Helicobacter pylori. The answer is A. Lupus erythematosus. When a patient has been sensitized, which of the following tests would be used to help identify the antibody that is attached to the patient's cells in vivo? A. DU. B. Indirect anti-human globulin test. C. Direct anti-human globulin test. D. Elution. The answer is D. Elution.
The flukes and tapeworms parasitic in man belong to the phylum A. Protozoa, B. Nematoda, C. Arthropoda, D. Platyhelminths. The answer is D. Platyhelminths.
The degree that a procedure deviates from a known value or from a calculated mean value is known as A. Percent deviation, B. Quality control, C. Standard deviation, D. Coefficient variation. The answer is C. Standard deviation. The ketone test area on a dipstick is impregnated with A. Ferric chloride, B. Nitroprusside, C. 2,4-dichloroaniline, D. Alkaline copper. The answer is B. Nitroprusside. During the crossmatch procedure, a negative result on the addition of Coombs control cells indicated that the A. Crossmatch is incompatible, B. Antiglobulin reagent is inactivated, neutralized, or not added to the test, C. Antiglobulin reagent is detecting antibody globulin, indicating adequate washing during the crossmatch procedures, D. Crossmatch is compatible and the blood may be infused. The answer is B. Antiglobulin reagent is inactivated, neutralized, or not added to the test. Unconjugated bilirubin is also known as A. Biliverdin, B. Total bilirubin, C. Conjugated bilirubin, D. Prehepatic bilirubin. The answer is D. Prehepatic bilirubin. What is the normal ratio of bicarbonate to dissolved carbon dioxide in arterial blood? A. 10:1, B. 20:1, C. 30:1, D. 1:10. The answer is B. 20:1. Group O patients can safely receive plasma from a donor who is group A, O only, B, A only, C, AB only, D, A, AB, or O. The answer is D, A, AB, or O. Which one of the following hemoglobin determination methods is recommended by the International Committee for Clinical Laboratory Standards and the National Committee for Clinical Laboratory Standards? A. Sulfhemoglobin, B. Synmethemoglobin, C. Oxyhemoglobin, D. Methemoglobin. The answer is B. Synmethemoglobin. Antihuman serum globulin Coombs is not used in performing A. DU testing, B. Reverse typing, C. Autoagglutination tests, D. Immunoglobulin testing. The answer is B. Reverse typing. The organism that can cause rheumatic fever and/or glomerular nephritis is A. Streptococcus pyogenes, B. Staphylococcus aureus, C. Staphylococcus hemolyticus, D. Streptococcus viridans. The answer is A. Streptococcus pyogenes.
Parasitic infections can be life-threatening in acquired immunodeficiency syndrome patients. A. True, B. False. The answer is A. True.
Which one of the following is characteristic of any antigen? A. Produced by action of antibody. B. High molecular weight. C. High order of specificity. D. Foreign to animal. The answer is C. High order of specificity. Cerebral spinal fluid patients with post-cerebral hemorrhage appears A. Light yellow or straw-colored. B. Bright red. C. Clear, colorless. D. Green. The answer is A. Light yellow or straw-colored. The distance between the ruled surface and cover slip of the hemocytometer is A. 1.0 cm. B. 1.0 mm. C. 0.1 cm. D. 0.1 mm. The answer is D. 0.1 mm. To determine if a patient is A1 or A2, the blood is typed with A. Anti-A serum. B. Anti-A2 serum. C. Dolichos biflorus serum. D. Anti-AB serum. The answer is C. Dolichos biflorus serum. Which of the following conditions is associated with hypophosphatemia? A. Rickets. B. Renal failure. C. Hypervitaminosis. D. Multiple myeloma. The answer is B. Renal failure. The major cation found in the extracellular fluid is A. Potassium. B. Bicarbonate. C. Chloride. D. Sodium. The answer is D. Sodium. According to Landsteiner, when a specific antigen is present on blood cells, the corresponding antibody A. is absent from the serum. B. is present in the blood cells. C. is present in the serum. D. may or may not be present depending on the agglutinogens present. The answer is A. is absent from the serum. Obstruction is used to help identify A. Streptococci producing alpha hemolysis. B. Streptococcus pyogenes group A. C. Streptococcus pneumoniae. D. Staphylococcus aureus. The answer is C. Streptococcus pneumoniae. Metabolic acidosis can be detected by testing urine for the presence of A. ketone bodies. B. glucose. C. uric acid. D. protein. The answer is A. ketone bodies.
Which of the following are practical methods of parasite control? A. Drug treatment. B. Immunization. C. Sanitation. D. Insecticide spraying. The answer is A, C, and D. Drug treatment, sanitation and insecticide spraying.
The R.A. latex test is used as a screening test for A. infectious mononucleosis. B. rheumatoid arthritis. C. thyroiditis. D. vulvovaginitis. The answer is B. rheumatoid arthritis. Most of the plasma thyroxine T4 is A. bound to globulin. B. free. C. bound to cholesterol. D. bound to albumin. The answer is A. bound to globulin. Hansel's stain is appropriate for A. Phagocytic neutrophils, B. Leukocytes in spinal fluid, C. Nasal secretion for eosinophils, D. Circulating eosinophils. The answer is C. Nasal secretion for eosinophils. The quantity of inactivated serum used for qualitative VDRL test is A. 0.02 ml, B. 0.05 ml, C. 0.15 ml, D. 0.10 ml. The answer is B. 0.05 ml. Which of the following is the primary mechanism of compensation for metabolic acidosis? A. Bicarbonate excretion, B. Aldosterone release, C. Release of epinephrine, D. Hyperventilation. The answer is D. Hyperventilation. Which organisms are described as minute, very pleomorphic, sometimes cocobacillary, gram-negative rods that must have media enriched with X and V factors? A. Bacillus anthracis, B. Haemophilus influenzae, C. Escherichia coli, D. Listeria monocytogenes. The answer is B. Haemophilus influenzae. The screening or presumptive test for the osmotic fragility of red cells is normal when hemolysis begins in A. 0.90% sodium chloride, B. 1.34% sodium chloride, C. 0.50% sodium chloride, D. 0.85% sodium chloride. The answer is C. 0.50% sodium chloride. Supravetal staining of red cells with a deficiency of G6PD will demonstrate the presence of A. Heinz bodies, B. Rubroblasts, C. Howell-Jolly bodies, D. Plasmodium species. The answer is A. Heinz bodies.
Upon examination of stool material for Isospora belli, one would expect to see A. Cysts containing sporozoites, B. Precysts containing chromatoidal bars, C. Oocysts that are acid-fast, D. Sporozoites that are hematoxylin positive. The answer is C. Oocysts that are acid-fast.
Clot retraction can be employed as an indicator of A. Hemophilia, B. Factor VII deficiency, C. Platelet function, D. Factor X deficiency. The answer is C. Platelet function. Microscopic examination of urinary sediment discloses small, motile cells having an oval head with a rather long, delicate, whip-like tail. These cells are most likely identified as A. Trichomonas vaginalis, B. Proteus vulgaris, C. Spirochetes, D. Spermatozoa. The answer is D. Spermatozoa. Freezing point depression measurements are part of which one of the following urine test procedures? A. Refractive index, B. Osmolality, C. Hydrometry, D. Specific gravity. The answer is B. Osmolality. What is the normality of a solution of sodium hydroxide, molecular weight equals 40, containing 20 grams in 100 milliliters of solution? A. 5.0 N, B. 0.5 N, C. 1.0 N, D. 0.4 N. The answer is A. 5.0 N. According to the Lancefield scheme of classifying the Streptococcus species, the Neterococci are placed in group A, C, B, D, C, A, D, B. The answer is B, D. In absorption spectrophotometry, A. Absorbance is directly proportional to concentration. B. Percent transmittance is directly proportional to transmittance. C. Absorbance is directly proportional to transmittance. D. Percent transmittance is directly proportional to concentration. The answer is C. Absorbance is directly proportional to transmittance. On most automated cell-counted, background counts are made using A. Distilled water. B. Highly diluted blood. C. Diluting fluid. D. Lysing reagent only. The answer is C. Diluting fluid. Which one of the following may detect a hemolytic transfusion reaction? A. Urine porphyrins. B. Serum haptoglobin. C. Post-transfusion red blood count and hemoglobin. D. Pre-transfusion bilirubin. The answer is B. Serum haptoglobin. The principle involved in some automated blood cell counters is based on the A. Value of the cell indices. B. Weight of the hemoglobin in the red cell. C. Size of the particle being counted. D. Amount of hemoglobin in the red cell. The answer is C. Size of the particle being counted. Which of the following tests is used to measure capillary fragility? A. Prothrombin time. B. Bleeding time. C. Partial thromboplastin time (PTT). D. Tourniquet. The answer is D. Tourniquet.
Eating poorly cooked pork can lead to an infection with A. Taenia solium and Trichinella spiralis. B. Taenia saginata and Hymenolopus nana. C. Trichuris trichiura and Hymenolopus diminuta. D. Diphyllobothrium latum and Ascaris lumbricoides. The answer is A. Taenia solium and Trichinella spiralis. Both Taenia solium, pork tapeworm, and Trichinella spiralis can be acquired from the ingestion of raw or poorly cooked pork.
Blood group A individuals have A. Anti-A in their serum. B. Anti-B in their serum. C. Antigen A and B on their red cells. D. Anti-O in their serum. The answer is B. Anti-B in their serum. The etiologic agent of chancroid is A. Bordetella pertussis. B. Haemophilus aegyptius. C. Haemophilus ducreyi. D. Haemophilus influenzae. The answer is C. Haemophilus ducreyi. A reactive fluorescent treponemal antibody (FTAAB) test A. indicates no infection. B. indicates the severity of infection. C. confirms the presence of treponemal antibodies. D. is positive during the chancre stage. The answer is C. confirms the presence of treponemal antibodies. A substance that produces a prolonged prothrombin time when given orally is A. heparin. B. salicylate. C. protamine sulfate. D. Coumadin. The answer is D. Coumadin. Which of the following conditions will cause an increased anion gap? A. Diarrhea. B. Hypoaldosteronism. C. Renal failure. D. Hyperkalemia. The answer is D. Hyperkalemia.
The type of anemia usually associated with severe burns is A. Macrocytic. B. Microcytic. C. Hemolytic. D. Aplastic. The answer is C. Hemolytic. Osmolality of a solution is determined by measuring A. Refractive index. B. Freezing point depression. C. Ionic strength. D. Specific gravity. The answer is B. Freezing point depression. Which of the following enzymes are present in heart muscle? 1. Lactic dehydrogenase LDH/LD. 2. Creatinine phosphokinase CPK/CK. 3. Serum glutamic oxaloacetic transaminase SGOT. A. 2 only. B. 1, 2, and 3. C. 1 and 2 only. D. 2 and 3 only. The answer is B. 1, 2, and 3. An RBC exhibiting hypochromia would be described as being A. Markedly bluish in color. B. Packed with hemoglobin. C. Variable in shape. D. Markedly pale in central pallor. The answer is D. Markedly pale in central pallor. Cell-antibody mixtures used in tube testing to determine a BO group should be centrifuged for A. 5 minutes at 5,000 revolutions per minute. B. 3 minutes at 3,000 revolutions per minute. C. 2 minutes at 2,000 revolutions per minute. D. 15 to 30 seconds at 1,000 revolutions per minute. The answer is D. 15 to 30 seconds at 1,000 revolutions per minute. Alkaline phosphatase is greatly elevated in A. Kidney disease. B. Liver disease. C. Myocardial infarction. D. Obstructive jaundice. The answer is D. Obstructive jaundice. On an automated blood cell counter, the two parameters affected by a high background count would be A. RBC and hemoglobin. B. RBC and WBC. C. Hematocrit and WBC. D. WBC and hemoglobin. The answer is B. RBC and WBC. Which one of the following is a function of gamma globulin? A. Performs as fibrinogen for blood coagulation. B. Provides humoral immunity. C. Transports glucose. D. Regulates body temperature. The answer is B. Provides humoral immunity. Rh immune globulin is given to an Rh-D. A. Positive mother with an Rh-D negative fetus. B. Positive mother who has an Rh-D negative husband. C. Negative mother with an Rh-D negative fetus. D. Negative mother who has delivered an Rh-D positive fetus. The answer is D. Negative mother who has delivered an Rh-D positive fetus.
Which of the following best represents the reference normal range for arterial pH? A. 6.85 to 7.56. B. 7.42 to 7.52. C. 7.28 to 7.68, D. 7.35 to 7.45. The answer is D. 7.35 to 7.45.
When using a buffer with a pH of 8.6, each of the serum proteins in an electrical field migrates toward A. the negative pole, B. either pole, C. the positive pole, D. both poles. The answer is C. the positive pole. Which media is used to isolate Staphylococcus aureus from specimens that have mixed bacterial flora such as feces? A. Mannitol salt agar. B. McConkey agar. B. An enrichment broth. D. Eosin methylene blue agar (EMB). The answer is A. Mannitol salt agar. An elevated leukocyte count with increased numbers of neutrophilic granulocytes usually indicates A. bacterial infection, B. viral infection, C. allergic reaction, D. infectious mononucleosis. The answer is A. bacterial infection. During the maturation of a blood cell, the nuclear chromatin pattern becomes A. finer, B. more dense, C. less dense, D. more acidic. The answer is B. more dense. When using white blood cell pipettes for performing a white cell count, blood is diluted. A. 1:20, B. 1:50, C. 1:10, D. 1:200. The answer is A. 1:20. Which instruments do not measure concentrations of a particular molecule but of the total ions and molecules in general, number of moles per kilogram of water? A. blood gas analyzers, B. osmometers, C. immunochemical analyzers, D. spectrophotometers. The answer is B. osmometers. Most methods for the determination of blood creatinine are based on the reaction of creatinine and A. ammonium hydroxide, B. alkaline picrate, C. sulfuric acid, D. acetic anhydride. The answer is B. alkaline picrate. Bordet Gangu and Yugon agar base with fresh blood is used for the isolation of A. Bordetella, B. Pasturella, C. Haemophilus, D. Yersinia. The answer is A. Bordetella. Fungi are commonly identified on their basis of their A. sporulation and the arrangement of spores on the hyphae, B. serologic and biochemical characteristics, C. staining properties with polychrome dyes, D. solubility in 20% potassium hydroxide. The answer is A. sporulation and the arrangement of spores on the hyphae.
Which formula correctly describe the relationship between absorbance and %T? A equals minus log %T minus 2, B A equals 2 minus log %T, C A equals 1 plus log %T, D A equals 2 plus log %T. The answer is A equals minus log %T minus 2. The modified grease nitrite test, when positive to any degree, is virtually diagnostic of A. bilirubin in the urine, B.
Any bacteriuria, 10, 1 to 10, 5 organisms per milliliter of urine. C. Significant bacteriuria, 10, 5 organisms per milliliter of urine. D. Phenylalanine in the urine. The answer is C. Significant bacteriuria, 10, 5 organisms per milliliter of urine. Reticulocytes contain A. DNA remnants, B. Howell-Jolly bodies, C. Basophilic granules, D. RNA remnants. The answer is D. RNA remnants. Brilliant crescel blue or new methylene blue are stains used for counting A. Malaria, B. Reticulocytes, C. Platelets, D. Howell-Jolly bodies. The answer is B. Reticulocytes. A trophozoite of Entamoeba histolytica usually contains A. Eccentrically located endosome in the nucleus, B. A coarse, granular, blunt pseudopod, C. Bacteria and coarse granules in the cytoplasm, D. Red blood cells in the cytoplasm. The answer is D. Red blood cells in the cytoplasm. A donor who recently tested positive for hepatitis B surface antigen should be deferred A. For 5 years, B. For 6 months, C. Permanently, D. For 1 year. The answer is C. Permanently. Beer's law states that the darker the color produced, the more light absorbed in the specimen. The more light absorbed A. The higher the concentration of the analyte, B. The lower the concentration of the analyte, C. The more light transmitted, D. The longer the wavelength required. The answer is A. The higher the concentration of the analyte. The end product of purine metabolism is A. Urea, B. Uric acid, C. Creatinine, D. Creatine. The answer is B. Uric acid. In the 1980s, Ewing, Burgee, and the Centers for Disease Control and Prevention, CDC, divided the Enterobacteriaceae into several different tribes. Which one of the following is not a valid tribe under their classification scheme? A. Escherichiae Escherichia shigella, B. Salmonella and Shigellii Salmonella shigella, C. Citrobacteriae Cytobacter, D. Edwardsiella Edwardsiella. The answer is B. Salmonella and Shigellii Salmonella shigella. To make a 1:5 dilution of serum sample, dilute A. 1.0 ml of serum plus 6.0 ml of diluent, B. 1.0 ml of serum plus 4.0 ml of diluent, C. 5.0 ml of serum plus 1.0 ml of diluent, D. 1.0 ml of serum plus 5.0 ml of diluent. The answer is B. 1.0 ml of serum plus 4.0 ml of diluent.